which doctors should you go see when it comes to eyelid surgery? As an oculoplastic surgeon, I've spent my entire career focusing on the eyelids when it comes to plastic and reconstructive surgery. So it's important for you when you're going to find a surgeon to help rejuvenate your eyes, your eyelids, to make sure that that surgeon has received adequate training when it comes to eyelid surgery. Most oculoplastic surgeons undergo a rigorous fellowship after their residency where it's solely dedicated to cosmetic and reconstructive eyelid surgery. So it's important to find a surgeon that's either undergone an oculoplastic training fellowship that I mentioned, or any other surgeon that has received adequate training, whether it's in their plastic surgery or facial plastic surgery fellowship. You need to find somebody that's really honed in on the type of procedure you're looking for as well. There are many surgeons that specialize in eyelids, but it may very well be that they're more experts in reconstructive surgery. So if you're particularly looking for somebody that is a cosmetic eyelid surgeon, it's important for them to not only have been trained in that, but also to perform those surgeries quite regularly, not weekly or monthly, but almost on a day-to-day basis. And that's important for you to know when it comes to searching for your surgeon that can help you in your journey. Is there an age that I operate on when it comes to patients with eyelid surgery? In general, no, but I do like to operate on people that are in their adult years when it comes to cosmetic surgery. So I have operated on people in their 20s with very prominent lower lid fat pockets. They've suffered from them since they were a child, and it's gotten worse with time, and they're really bothered by them. And on exam, they have very significant fat pockets, and they're only in their 20s. So yes, I will help them. Yes, I will do what I can through a blepharoplasty procedure with fat repositioning in those instances to help rejuvenate them to a better place. There's no necessarily an age limit, but it certainly comes with the exam findings. Droopy eyelids is another example. People are often born with droopy eyelids, and I often see people in their teenage years or in their early 20s where they've suffered from low-set eyes, ptosis, and yes, they're great candidates for surgery. On the spectrum, I have patients in their 50s or 60s that come see me and they have virtually no fat pockets present in their lower eyelids. They just want a little bit of work done in their upper eyelids, which we can do in the office. So certainly age is not the only criteria when it comes to performing eyelid surgery in my practice. This is a very common question I get from my patients is, Doc, have I asked what I need to ask when it comes to what I need to know about having eyelid surgery? So it's important for you to know that eyelid surgery is a procedure that can really help improve you if you're suffering from extra skin in your upper eyelids or fat pockets in your upper or lower eyelids, or you're having this tired appearance, and that I or any other surgeon has actually recommended that you'd be a great candidate for an eyelid surgery. So what you should need to know is that the surgery will help you in rejuvenating your eyes and getting you to hopefully the goals that you want. The surgery is long lasting depending on what's being done, but generally speaking, this is a fairly permanent procedure. My job is to reset the clock of your eyes to be at a better place. There is some downtime associated with this procedure. This procedure, whether it's upper lids, lower lids, or both, is a fairly minor procedure. You do go home the same day, but there is some downtime. And it's important for patients to know that it's okay to just lay low for a week or so after the recovery, after the surgery, in order to recover properly. A lot of my patients want to go and start working out again. It's really important for you to take it easy for about a couple weeks when it comes to being active. I don't want you to do any exercise or heavy lifting for about 2 weeks. A little bit of achiness and soreness is totally expected the first day and generally gets better after that. It's normal to be bruised and swollen. Most bruising and swelling gets better after 2 weeks. So it's important for you to know that you need to take time off from being out in public, for instance. If you really want to be low key, take it easy for a couple of weeks. I generally tell my patients that you should be okay to see people in public in about 2 weeks. Now, you may still have some bruising, you may still have some swelling, but most of it should be better by then. In terms of the incision, the upper lids generally have an upper lid incision. You should know that it takes time for the upper lid incision to heal. It's not going to heal in a day or two. It'll take weeks, but every week will get better. The redness that you see initially along the incision, the hyperpigmentation that you may see along the incision, the thickness that you may see along the incision, all will get better with time. My job is to make sure you heal as best as possible. Everybody heals differently. Some people may have very minimal incisional scarring effects. Some may have more. And my goal is to help make sure you heal well using Skinuva Scar, which is a patented, clinically proven product to help improve your incisions after healing, adequate use of sunscreen if you're going out in the sun, and if the incisions still have some raised areas, that are tender and not healing, for instance, as well as they should, that's where I can inject some light steroids, which I do in the office every so often, to really help accelerate the wound healing process. So who can have eyelid surgery? Well, in general, anyone that has issues that eyelid surgery would help with would be a great candidate from that aspect. So extra skin in the upper eyelid, excess fat pockets in the lower eyelids, or combination of both, making you look more tired. If you have low set eyebrows or brow ptosis, a brow lift can be done at the same time. So generally speaking, if you have conditions that would allow for you to have an improvement through an eyelid surgery, then you could possibly be a very good candidate. Making sure that your health is clean, making sure that you're healthy, making sure you have no active medical conditions or issues, they need to be optimized before any sort of surgery. Active dry eyes should also be controlled before surgery. Anyone that has active dry eyes should not be undergoing eyelid surgery until that is controlled. Any sort of surgery to the eyes can actually make the dry eyes worse. Generally, having a good state of well-being and a positive attitude toward life and surgery is really important. I like to operate on patients that are really excited about having the surgery. It's normal to be a little bit of anxious, of course, but to be excited to understand what the surgery is going to help with, and also aware about the limitations of the surgery. It's important for patients to kind of know those going in, so they'll have the best results and understanding the outcome and being super happy with what the plan was and how they recovered. So in general, it's important for you to have your health optimized before you're having eyelid surgery. So if you have diabetes, high blood pressure, or other medical problems, it's important for them to be controlled and optimized before having any sort of surgery, especially eyelid surgery. Diabetes should be optimized, well under good control. If it's not, you probably will not heal well. There may be delays in healing and prolonged recovery. When it comes to high blood pressure, you really want to make sure the blood pressure is controlled. Medications are so effective in making sure that it's within the limits of what your doctor is okay with and what we're okay with. Because ultimately, if it's uncontrolled, you're going to end up having more issues of recovery and bleeding, and you don't want to be going in that scenario. And so that's important for us to make sure that you're optimized with the care of your doctor to get the best results as possible. Can other procedures be combined with an eyelid surgery at the same time? Absolutely. In my practice, I focus exclusively on cosmetic eyelid surgery and also brow lifting surgery. So patients can have a brow lift done with an eyelid surgery at the same time. However, if they're interested in having a facelift at the same time, or neck lift and or rhinoplasty, those are procedures that can be done at the same time. And one of the colleagues I work with is my brother, who's a fantastic board certified facial plastic surgeon, and he's one that I can tap into when it comes to combined work that we can do with some of our patients. Common question I get from my patients is, will eyelid surgery change the shape of my eyes or change the shape of my face? I have a practice where a lot of my patients are males. I'd say about 50% of my patients are males, and so they don't want to look like they've had eyelid surgery. And also my female patients have the same concern. So when it comes to eyelid surgery and the techniques that I use, for instance, when it comes to lower eyelid surgery, the goal that I have is to essentially keep the eyelids as natural looking as possible without changing the shape of the eyelids, without making them look like they've had a procedure done. In most cases, that's incredibly achievable because the work is done through an approach that does not require an incision that's visible. It's all done through a transconjunctival approach, or what we call a non-visible incisional approach. That avoids direct excision of the skin, that avoids direct injury to the muscles, and also does not require for me to do any tightening in the corner of the eyelids to bring them up after surgery. In general, when I do my eyelid surgery procedures, which involves usually blepharoplasty with fat repositioning, essentially it's a type of volume preservation, you should not expect to have your eyelid shape changed. Upper lids, same thing. When I'm removing excess skin from the upper eyelids, that necessarily does not result in a change of the eyelid shape. You're just removing excess skin. However, some patients where they actually have droopy eyelids, that's called ptosis, where the eyelids are actually low set, you're having difficulty seeing, you look tired all the time. In order to improve ptosis, that droopy muscle needs to be tightened. So in a sense, you're lifting the eyelids up, and yes, you're gonna have a change in your eyelid shape because essentially your eyelids were low and now you're opening them up. So yes, you are having a change in shape to your eyelids with that particular procedure, but ultimately it's for the better. You're able to see, you're able to have a contour that's relatively natural, whereas before was flatter. So in general, that's how I like to answer if eyelid shape changes with eyelid surgery. There's risks with anything we do in life. The important thing here is when it comes to getting a procedure done, to making sure that you're minimizing risks as much as possible with that particular procedure. So in my practice, I perform eyelid surgery. I try to minimize risks, complications as much as possible to make sure the patient has the best outcome, to make sure that the patient has the best results, to make sure that the patient heals well. and reducing any of these risks or complications. So first and foremost, picking the right patient. My job is to make sure I take care of the right patient, the one that's going to do the best from the surgery, the one that really will benefit from eyelid surgery. Also, it's important to operate on a patient that has no active medical issues or has no active dry eye or any other active eye issues. You want to make sure they're in an optimized, healthy place. Now, in terms of the surgery, it's important to pick the right procedure for the patient. If somebody has very little extra skin, and I end up removing a lot of skin, well, that's not ideal result, because then you're creating a problem where the patient may suffer from long-term dry eyes and not close their eyes. So I'm very careful and detail-oriented when it comes to identifying who's a good candidate for an upper eyelid blepharoplasty. And when I do my markings, to make sure that the amount of skin I'm removing is perfect, that it's not going to cause any problems. And in terms of the recovery process, patients need to know that it's normal to be bruised and swollen after surgery. Patients also need to know to take it easy for the first week. No heavy lifting, no strenuous exercise, taking the right medications, making sure their blood pressure is controlled. Sometimes some abnormal bleeding can occur. It's incredibly rare, but that's why we optimize our patients, tuck them in, make sure that they heal well. If there are any issues, we'll jump right on it to make sure that they continue to heal well despite some issues like that.